All right, I'm going to show you some instruction on home cupping. So this is if you have somebody at home can cup you, how to use the silicone cup. So there's lots of different kinds of cups out there. This is the kind that I tend to use. There are the hard plastic ones, but I find these to be best. So the color doesn't matter, the blue or the clear. In this one in particular, there are 4 different cup sizes. And you have to be careful that you get the extra large size. So the extra large is really big. It's I think 3.25 inch. So this is extra large, this is large, this is small, and this is extra small. Most of the cups that they sell don't have this extra large, and if you're planning on doing large body parts, I would recommend getting the extra large. So what you'll notice with the cups too is that they tend to, they'll change their color as they get older. So this is an older cup, and you can tell it becomes a little bit more opaque, whereas the newer ones are more clear. So the older ones are going to be more flexible, the newer ones are going to be stiffer, and they will feel different. So just know that over time that the cups will wear down. So today I'm going to be doing some dynamic cupping. So dynamic cupping means that you move the cup around. So to use dynamic cupping, you need some kind of an emollient, and so I like to use the cocoa butter. It's very thick. You actually have to scoop it out so it would not come out of a pump. And so I use the cocoa butter, and then I use several cups. You'll see people who have the cupping marks. So if I put a cup on here and I left it there, it would leave a big red circle. So that red circle looks like a bruise, but it doesn't feel like a bruise. It's more like a hickey. It's drawing blood to the area. And I like to do more dynamic cupping. So that would be a static cup right there. And I'm going to show you how to use how to do dynamic cupping. So I'm going to start by working on the neck. So I'm going to use some cream here, and I'm going to do the neck first. So I'm putting some cream right on the neck, and I'm going to use a large cup here. So what you need to do is you need to squeeze the air out of the cup, and then you place it down. Okay, so I have 2 hands here. I'm going to press down and then lean on one side to push the cup down, okay? So the amount of air that you push out will determine the amount of tension, and then once you have that cream, then you can move that cup around, okay? So if you've never had cupping before, then you probably want to start by doing more of a static cup where you put a cup on. It does tend to be a little bit more intense as you move the cup. But the benefits of dynamic cupping is that you're going to get the benefits of cupping in that whole area instead of just under that one circle. So I just put that cup on and I'm moving it around. So as you can see, the skin starts to get red, and that's a completely normal response. And you want to be asking, does that feel okay? Does that feel too tight? And usually you can tell. They'll start to wince and move away if it's too much, if they're being shy about giving you feedback. But how does that feel? Feels okay? Good. Not to say that you can't sometimes leave a cup. So I will put a cup right there. So what the cup is doing is giving lift to that area so the 3 layers of the skin can get squashed down. So we're trying to create some space between the layers, which can help with nutrition. So you'll find that as you're sliding that cup around, you'll lose suction, and then you just resuction it. Let's say you have the cup here and you want to take it off and you go to just pull it off. That's really not that comfortable. So what I would recommend is you take your thumb and you break the seal, okay? So that area right there, I just did what's called the cervical thoracic junction. And so I'm actually going to take that cream off. It feels kind of funny to leave that cream on. So when you move from one area to the other, I tend to take that cream off. So I'm focusing today just on just along the spine. So I'm now going to move down into the thoracic region. And you'll find that a different amount of emollient is necessary. If people's skin is really dry, then you'll have to do more. So right now I'm doing along what's called the paraspinal. So those are the muscles along the spine. And I'm going to move to the other side. So looking at how red the skin gets tells you if you've ever had cupping before, you're going to tend to have more of a response. So this is the first time that I've ever done cupping on Luke. So does that feel okay, Luke? Yeah. Okay. So you can go along the spine. So based on the muscle mass, it can be hard to kind of keep it on the spine. So right now I'm using that large cup, but I'm going to try to do a smaller cup. The smaller cup can be a little bit more intense. So again, I'm pushing the air out, so I'm creating a negative pressure, and then I'm laying it down and releasing that. So if I try to go right along that spine, does that feel more intense? Or not really, Luke?
Not terrible.
Okay. So just so you can see the effect of leaving a cup, I'm going to take this cup and actually slide it right up to along his shoulder blade, and we'll leave that one there. So you can go up and down, you can go side to side. So again, you're looking at the skin to see how red the skin gets. Sometimes at spots that are really sensitive, it will get redder there, or where things are sort of matted down. Okay, so now I'm going to work more on the lumbar spine and the sacrum. So I'm just going to use a towel to hold down to expose his lumbar spine. So actually, let me take some of this cream off. I have never had anyone who's had any reaction to this type of cream, so it's worth asking though if you have somebody who has sensitivities, what cream works for them. So, all right, so now I'm coming down to the lumbar spine. Again, you can cross that spine or you can come up and down. There's not a lot of flesh right here, right where the low back meets the pelvis, and that can feel a little bit more intense. But the fascia can be quite stiff there, and it's hard to stretch that. So if you think about what we do with foam rolling, we're squishing that tissue, helping to mobilize it, and this is the opposite of that, where we're creating a vacuum. Does that feel more intense there, or not so much?
Yeah.
Okay. So I usually like to use a larger cup down here, so that's where this extra large cup can be really beneficial. So again, I'm pushing the air out. If you lay one side down and then add the whole circle, that's where I find the most success. So this is a big cup, and again, I'm doing dynamic cupping, which means I'm moving that cup. What I will do, particularly for the low back and the upper glutes, is you can place the cup down here and then actually do different exercises with that cup on here. So I've left this one at the top so that we can see that red mark form. And you can certainly have some static cupping and some dynamic cupping together. But this is a great spot to put a static cup. So I'm at the very bottom of his lumbar spine, just at the top of his glutes. And then you can keep that cup on, and stand up, do some squats, do some lunges, do some deadlifts, and sometimes the cup will pop off, but what's gonna happen is that skin is gonna move underneath that cup in the process of you doing an exercise. So you don't necessarily have to move that cup around. You can have a static cup, but a dynamic body. Right now it's a static body and a dynamic cup. And again, this feels kind of bony down here, but if you start to lose tension, you just reattach it. Make some lovely noises too. Okay, so if I want to take this cup off, I'm not just going to yank it off, but I'm going to break the seal and take that cup off. So you'll see that there's a bunch of cream that's left in here. So you have to be careful with these cups that you keep them clean. So I use a tongue depressor. I scoop that cream out. And then I use some kind of a Dawn dish soap, and then I sanitize them. So especially if within your family you're going from person to person, you want to make sure that you keep those cups clean. Okay, so we've left this one on for a second, we've left this one on for probably about 4 minutes here, so let's go ahead and check what that looks like. So, again, if I try to just take this off, I can take it off, but that can be pretty uncomfortable, so I tend not to do that. So for this one up here, we're gonna pop that one off, and then you can see that red circle there. For a young, healthy patient or family member, that redness will go away pretty quickly. The older you are, the more fragile your skin is, then that can actually leave a mark for a few days. If a family member is on blood thinners, then you really want to be very careful with the cupping. In fact, I probably would stay away from cupping for anyone who's on a blood thinner. And a lot of it is just trial and error and getting a sense of what that feels like. And along the spine is totally fine. And again, this is the cupping. This one I got off of Amazon. 4 cups, different sizes, is around $30. So that's a little instruction on cupping. Good luck.